recording now. And let's go to chapter 11, muscles of the body. So I will go over an overview of the muscles of the body, the background information, then muscles arrangement, the muscle fascicles arrangement in different region of the body are different to perform different functions. And we're going to talk about them. Then muscles in the body, they interact to perform certain function. So we will talk about action and interactions of group of muscles. There are compartment of muscles. Certain group of muscles are encased in the dense regular connective tissue, deep fascia, and they are one compartment. And the compartment of muscles are more pronounced, clear in the limbs, like upper limbs, hands and arms and upper limbs, and in the lower limbs. And we're going to talk about those compartments. Okay. So the compartment and compartment syndromes. Then we will talk about naming of the skeletal muscle. So let's see, we say biceps, triceps, gluteus maximus, glute muscles, medius, minimus, brachioradialis, sternocleidomastoid. Why these muscles have different name? There is criteria for naming them, and we will talk about those criteria. Okay. And then I have posted the major muscles of the body list. So identify the names, origin, insertion, and action of the muscles. Use the muscle list to identify the muscles. I have made the list of clinically important muscles to identify them in the diagrams, 3D models, which can be 3D models and cadaver models. Now there is no real cadaver, they are all electronically, so you can cadaver models and identify them. Like, do you remember last time the bone list? Bone lists where some of the bones have no feature, some of the bones have one feature, some of the bone has 5 features. Exactly the same way, muscles. Some of the muscles you just need to know the names where they are. And at the beginning, first thing you do, take the list and identify where they are so that you can close your eyes and imagine where these muscles are. Just identify the names. Once you are able to identify the names, then you can start identifying the origin, insertion, and action of the muscles. Okay. So here is the list of muscles before we go and talk about other thing. On this list of muscles, we will start today and we will continue tomorrow too, in the next class, not tomorrow. So if you want to open this list, so click control and then click on this muscle. It will open the list of muscles. You see, this is the list of the muscle. Can you guys see this list of the muscle?
No.
No?
It's not opening.
No.
No, I have shared. Can you guys see it?
No.
No?
No.
Okay.
If you just switch which screen you're sharing,
Yeah,
it's
I'm doing that. Yes. Okay.
it's also accessible on Canvas too.
Yeah, I have posted on Canvas too. So this is the muscle list. You see, muscle list by for human anatomy, and muscles are organized by the region. So you see, muscles name, head region. What are the muscles of the facial expression? like orbicularis oculi, orbicularis oris, zygomaticus, buccinator, platysma. And there is primary action, main origin, main insertion. If you see orbicularis oculi muscle, you just need to know action of the muscle. No origin, no insertion. That doesn't mean orbicularis has no origin or action. It has. Every muscle has origin and insertion. But for us, it is not important. When you come to zygomatic muscle, you can see zygomaticus, the primary action is it creates a smile. Primary origin is zygomatic bone, and main insertion is skin and muscles at corner of the mouth. So that means zygomatic has, you have to know its primary action, origin, and main insertion. Similarly, all the muscles are orange here. So in the face and head, you have muscle of mastication, muscle in the neck, muscle in the trunk, muscle in the abdominal wall in the trunk, pelvic floor and perineum, thorax, muscle in the pectoral girdle. Pectoral girdle means the upper limbs and shoulder girdle. So muscles in the pectoral girdle are pectoralis major here. Crossing the shoulder joints. Which muscle cross the shoulder joints? Here is the list of shoulder joint crossing muscles. Crossing the elbow joint, muscles crossing the elbow joint, and the muscle of the arm and forearm. So forearm, anterior forearm, posterior forearm, because muscle mass in the arm is more, in the leg and arm and the thigh is more. So it has anterior and posterior muscles. Muscle name crossing the hip joint. Now lower limbs muscles, anterior thigh, posterior thigh, leg, anterior leg, posterior leg. So these are the muscles you need to know. Okay, so I have gone over these muscles, location, origin, and action in the My Lab 3.1 anatomy practice My Lab. And I have gone over each muscles. You can go there. There is a video of the each muscles animation. You can click on that. If you click on the video sign, the camera sign, it will open the animation videos, and that will show you exactly where they are originating from. If you are like visual in learning, you can do that. But it takes time. You cannot go the shortcut way. You have to spend time on those videos. Like it visual are 2-minute, 1-minute videos. Okay. But I will suggest first get into the diagrams in the PowerPoints, in the book, and learn the list, and then practice in um, practice lab. That will be easier. Okay. So this is the list, and I have posted the list in your Canvas. I have linked it in your PowerPoint. I have these all lists I talked about in your lab recording. So you have like several locations you can practice them. Okay. Only thing is these things needs at least 4-time practice. You have to go over 4 times to make it easier. Then you feel like you know it. And practice writing all the time. Okay. So that is the muscle list. I'm going to change the sharing now. I'm going to go back to my slide, PowerPoint slide. Okay. Okay. So today's lecture, I'm going to start with a clinical case. A 25-year-old female patient comes to the emergency room 2 days after the fracture of the leg with unremitting pain, muscle weakness, skin tightness, and diminished pulse. What is the possible pathophysiology and treatment of the conditions? That means This is the young patient, and there is fracture of the leg. And after fracture, 2 days, 48 hours, there is severe pain, weakness in the muscles, skin tightness, and most importantly, there is no pulse down below the fracture. So what does that say? That looks like there is swelling, increased pressure, which is compressing the blood vessels, and that's why there is no pulse. So what is these conditions? This is a condition of compartment syndrome, and we're going to talk about this when we talk about compartments. Okay. Muscles of the body, skeletal muscles produce movement. We did this at the beginning, like blinking of eyes, standing on tiptoes, swallowing food, dancing, jogging. All the functions are the function of your muscles, skeletal muscle. It works based on the principles of leverage. You know, there are three kinds of leverage: first degree, second degree, third degree, and they have like fulcrum. That's the physics. Based on those physics, each muscle works in our body. Muscles acts with or against each other. So group of muscles in the body, some muscles work together to perform one group of functions. Some muscles just oppose that action to undo the action of that particular muscles. Arrangement of fascicles in the muscles. So before we talk about arrangement of fascicles, let's talk about structural organization of muscles again. And you guys will guide me. So the first organization is a whole muscle. From the muscle, if we slice the muscle, what we're going to see the bundle, first bundle?
Epimysium.
No, epimysium is the covering. Is the covering. Inside the covering, what will be the group of muscle cells?
The fascicles.
And if I slash the fascicle, what will be the inside?
Muscle fibers. And
The muscle
Muscle
fiber.
fiber, muscle cell. And if I cross the muscle cells, then inside the muscle cells will be myofibrils. Yes. So muscle fascicles are the group of muscle cells, and they run in the same pattern. Okay. That's why arrangement of fascicles in the muscles is important, because these fascicles contract and bring one kind of functions. Okay. So fascicle arrangements in different patterns are in our body, and this tells us about action of that particular muscles. So let's see here types of fascicle arrangement. Let's go back to the diagram, and then I will come back. So you see the body, this diagram. Here we have A, B, C, D, E, F, and G. So some muscles are their fascicles arranged in converged form, and that is called convergent. So like the chest muscle, the pectoralis major muscle. So you see this side, the medial side of the muscle is big bulk, and they all converge and become a tendon, and then tendon is attached to the humerus now. So this type of muscle is called convergent. You see, A, pectoralis major is the convergent muscle. B, fusiform. Fusiform, here, this is the biceps brachii muscle. Why we call it biceps? Because it has two heads. That's why ceps means cephalic, means head. So it has two heads. And you see the middle part of this muscle is bundle, and each end is converged like a spindle. That's why we call it fusiform. Here, C is the muscle, which is the long, and each fascicles in this muscle is parallel to each other. That's why we call them parallel. And this is sartorius muscle. Another name for sartorius muscle is Sartorius. Another name for sartorius muscle is talar muscle. Do you know when there was no electricity, the sewing machine was operated by your leg, by your foot. So like pressing the foot, you turn the wheel, and that's how your sewing machine used to do. And to do that, you use a lot of this muscle. That's why it is called the talar muscle. Okay, so talar muscle or sartorius muscle is an example of fasciform. Not fasciform, sorry, the parallel. Okay, another muscle is group of muscle is the pinnate muscle. So pinnate means how muscle is pinned to the bones. Okay, so each muscle has to be attached to a bone. So G here it is a tendon which is attached to the bone, and then muscles are pinned to the tendon only from one side. That's why we call them unipinnate. An example is extensor digitorum longus muscle in the leg. Then you have in the thigh, this is the rectus femoris muscle. So you have tendon in the center, which is attached to the femur, and then muscle is two group of fascicles are pinned in the center from both sides. So there is bipinnate. Here is deltoid muscle, which is in the shoulder joint here in the arm, upper arm. There is the tendon in the center, and then muscle mass is attached from all the side, pinned. That's why we call it multipinnate. So these are the arrangement of fascicles in muscles. Okay. There is another muscle group we did not talk about, circular muscle. Each fascicles are circle here. You see? And this is one example, orbicularis oris. Similarly, you can find these muscles in the eye, orbicularis. This is orbicularis oris in the eye. Another muscle is orbicularis oculi. All the sphincter muscles are this kind, like your anal sphincter is this kind muscle. Okay. So this is the arrangement of fascicles, and these are all explained stepwise here and their example. Okay. Okay, let's talk about the muscles in the limb. So upper limb and lower limb muscles. In the limbs muscles, there is the bulk of muscle because our limbs are the most powerful organ which holds our body, and we lift and manipulate the world with our hands. That's why there is a lot of muscles. So limb muscles arise from the nearby myotome in the intrauterine life. Okay, so inside, if you see the arrangement of upper limb and lower limb in anatomical position, if this is upper limb, it flex when your hands comes forward, but lower limbs flex when your leg goes backward. Are you following me? That's why extensor muscles mass dorsal to limb bones and flexor muscle mass ventral to the limb bones. So let's see here. This is the upper limbs. They are just arrangement of the muscle is just opposite in the lower limbs. So posterior part of the upper limbs, posterior, are usually extensor muscles. Extensor muscle means the muscle which extend your arm. And anterior parts are flexor muscles, like biceps brachii, flexor carpi ulnaris. These are the flexor muscles. But in the lower limb, it is just opposite. You see, posterior is flexor, like hamstring, hammy muscles, and gastrocnemius muscle, whereas anterior is extensor muscles. You can compare. Okay, So again, check it. All the anterior muscles in the lower limbs are all the extensor muscle, the anterior muscles in the lower limbs are extensor muscles. True or false? This is not a hard question.
Will you
True.
please repeat that?
Can you repeat the question, please?
All the anterior muscles in the lower limbs are extensor muscles.
True.
True.
That's true. All the anterior muscles in the upper limbs are extensor muscles. True or false?
True.
False.
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 False. That's false.
Okay.
Okay. So now interaction of skeletal muscles in the body. So each time when you flex your elbow or arm, the anterior muscles are flexing. So all the muscles in the anterior part, either working for this directly or helping the main muscles to do this function. And the opposite muscles undo this action. So let's see if biceps brachii is flexing your elbow, triceps brachii undo that action. That means triceps extended. Okay. So muscle cannot reverse the movement it produces. Another muscle must undo the actions. Muscles with opposite action lie on the opposite side of a joint. Okay. So based on that action and interaction of the muscles, we can divide muscles into several group, okay, functional groups. They are prime mover or agonist, antagonist, synergist, and sometimes a spatial synergist is also called fixator muscles. So prime mover or agonist are the major muscles which is responsible for a certain movement. For example, what is the main muscle which flex our arm or elbow? Biceps brachii.
Bicep.
So biceps brachii are the prime mover of the elbow flexion. And any muscles which helps to do this are agonist muscle, main muscles. It's like these muscles are called agonist. Biceps, under the bicep there is brachioradialis that also help that job. So that is agonist muscles. And prime mover is also called agonist muscles. Okay. Now antagonists are triceps because triceps oppose or reverse flexion. Now synergists help these biceps and other agonists to do this job. So what are those muscles? Like any muscles in the, like let's pectoralis major muscles, the deltoid muscles, the serratus anterior muscles, and other subscapularis muscles. These muscles all hold your joint, the shoulder joint and elbow joint, other muscle in the elbow joint, and help you flex. So those muscles are called synergists. So synergists help the prime mover or agonist. How they do that? By adding extra force. Either they help adding or reduced undesirable movement. Some synergists are called fixator. They are a type of specialized synergist that holds a bone in a firmly in a place and immobilize the origin of prime mover. So let's see, you have a scapula on the back, yes? Let's see, this is your scapula. Under the scapula, there is a muscle called subscapularis. That muscle is called subscapularis. This subscapularis muscle, when you are moving your shoulder joint or elbow, this subscapularis muscle holds your scapula on the shoulder joint. It prevents winging of the scapula, flapping of the scapula. So the joint is stabilized and you can move your joints and you can contract your muscle. This kind of subscapularis function in the shoulder joint is a fixator because that hold the origin of the prime mover like biceps in place when it is contracting. Okay. Muscle compartment of the limbs. In the upper and lower limbs, there are large group of muscles. That's why this group of muscles, certain group of muscles are put into one compartment, which are covered by dense fibrous connective tissue, tight, thick, dense fibrous connective tissue. And each compartment has a major nerve supply, a major artery, major vein, and major lymphatic vessels. Okay. And it is good because it holds the muscle during contraction and prevents rupture of the muscle, damage of the muscle. At the same time, when there is damage to that muscles in that area by accident, by fracture, by trauma or anything, then swelling inside the compartment can cause compartment syndrome because compartment is, so when muscle starts swelling up, there is no space in the compartment. Compartment is connective tissue. And in that case, the nerve, artery, and vein inside that compartment gonna be compressed. And if they are compressed, that means you are compromising blood supply, you are compromising veins, you are compromising nerves, you are compromising lymphatic vessels, and then tissue gonna damage and necrosis will start there. That's why compartment syndrome is very, very dangerous. Okay. So dense fibrous connective tissue divide limbs muscle into compartment, and we're going to see that. Muscle in opposing compartments are agonist and antagonist pairs, as I said earlier, and each compartment is innervated by single nerve, a single nerve. Okay. So let's see here compartments. Muscle compartments of the arm and forearm. I want you to first look into this diagram. Please pay attention. I'm going to find someone individually and ask you a question. That will reduce the distraction. So if you're here, pay attention to me. Shara, are you here?
Yes.
Okay. In this diagram, what is the main muscle which is forming the posterior compartment?
The triceps brachii.
Very good. Okay. So now, this is the muscle of the arm, pretty much upper limb. So you see upper limbs, we have cross section here in the arm region, and here is cross section in the forearm region. And this diagram is all about the cross section of the arm. Okay. So there is posterior compartment and there is anterior compartment. Posterior compartment is triceps brachii, anterior compartment is biceps brachii, and under the biceps you have brachioradialis. So the posterior compartment function you need to know. Posterior compartment of arm, extend your elbow. That's usual, you know that. All the posterior muscle extend. And anterior compartment, flex. And you see they have different group of nerves innervated by radial nerve. Radial nerve is the nerve which is the branch of axillary nerve. And anterior compartment is supplied by, innervated by musculocutaneous nerve. Now let's come to the muscle compartment of the forearm. So here is forearm cut section, and this is the. So you see, there is more muscles by name. By mass, it is not, but by names, there are several. So this is the posterior compartment, and maroon is the anterior compartment. So posterior compartment, you see this posterior compartment muscle from your forearm, it is crossing all the way to your fingers and your forearm, your palm. That's why whatever joint a muscle cross, action is at that joint. So you see, what is the action? When these muscle contract, they pull up. So this is posterior compartment of forearm that extend wrist and finger, and they are innervated by also the radial nerve. Okay. Whereas anterior compartment here, when they flex. Anterior compartment of forearm flex wrist and fingers, because these muscle tendon is reaching all the way to the finger, and they are innervated by median and ulnar nerve. Similarly, muscle compartment of the thigh. So let's go muscle compartment of the thigh. Look at here, another 30 seconds, and go by the compartments. Again, this is the lower limbs, transverse section of the muscle at the thigh level, and it is at the leg level. This diagram you're going to see in another slide, but here you can see in the thigh. Okay. So guys, how many compartments we had in upper limbs?
2.
2. And in leg, obviously we have more muscles. So you can see here 3 compartments. Okay. So those compartments are posterior compartment, medial compartment. This is the right patient's right leg. So you have, this is the right leg, right thigh. So you have posterior compartment. This is the medial compartment, and here lateral compartment. Okay. And several muscle groups are here. So let's talk about the posterior compartment. What is the function of muscles on the posterior side of the lower limbs? Flexion. So obviously the action will be posterior compartment of thigh flexes leg and extend thigh. See? And you do remember how you extend and flex? So extend thigh and flex the leg and extend the thigh. And this is innervated by tibial portion of the sciatic nerve. So sometimes when you have the pinching of the nerve in this lumbosacral region, that cause this hamstring muscle pain, and it shoots down in your leg. That's why. The medial side here, medial compartment, both. So this is this adducts the thigh. That means when you are in abducted position, these are the muscle contraction which brings your thigh inside. And this is innervated by obturator nerve, which passed through the obturator foramen of the bone. Which bone? Obturator foramen is the foramen in which bone?
Pelvic girdle.
Sorry?
Pelvis.
Pelvis bone. Good. It is the foramen in the pelvic bone. Now the anterior compartment, you know, anterior compartment here. Anterior compartment extends leg, and they are innervated by femoral nerve. Okay. Now the compartment in the leg. Again, in the leg, we have more muscles again, 3 compartments, posterior, anterior, but not medial, lateral. So in the thigh, you have medially more muscles, so medial compartment. In leg, you have laterally more, so lateral compartment. Okay. Now, same actions. If you understand the concept, what kind of muscles are in the anterior and posterior, these things will not be hard to remember. So posterior compartment of leg, when contract, what they do, they bring the action at the ankle joint. So posterior compartment, plantar flexes foot and flexes the toes, you see, and it is innervated by tibial nerve. Whereas anterior compartment of leg, dorsiflex foot and extend toes innervated by deep fibular nerve. So here in this diagram, you can study 2 things. Last time when we studied joint, you talked about joint movements, and I said I was not able to show you these 2 movements. You can see now what is the plantar flexion and what is the dorsiflexion. So plantar flexion is the flexion of the ankle joints where your toe is pointing towards the ground, or you are tiptoeing. And dorsiflexion is when in anatomical position you are pointing your great toe towards your body or towards your head. That is dorsiflexion. Okay. Now the lateral compartment of leg, plantar flexes and everts the foot and innervated by superficial fibular nerve. Okay. So now let's talk about the compartment syndrome. Compartment syndrome. So let's see, I'm going to go back to this. This is the femur, and our patient has trauma. Where was the trauma? In the leg or in the thigh?
I think it was the leg.
Leg. So let's see here. Here is the tibia. So the patient has tibia fracture. So when the patient has tibia fracture, what happens? It will damage maybe the posterior compartment or interior compartment, most possibly anterior compartment. Let's see. If anterior compartment is due to the effect of tibial fracture, the blood from here will come here and start damage of some tissue here. Then there will be swelling, starting swelling in this muscle inside, because cells are, the muscles is the tissues there. So there will be increased blood flow, there will be swelling. And once swelling start, what happened? This is the, you see white tissue. This is the dense fibrous connective tissue covering these muscles. So swelling can go so much. After that, what happens? You see the artery, vein, and nerve, these start compressing. And then once it compressed, blood from here will not come down here in the lower part here. That's why you have, if you take the pulse in the leg, that is called dorsalis pedis artery pulse, you will not feel the pulse. Due to the swelling, the skin will be tight here. There will be swelling, there will be increased temperature in this area due to inflammation. And that is called compartment syndrome. If you take a pressure, if you put a barometer to measure pressure inside these muscles, it will be increased pressure. That will be more than 30 millimeter of mercury. intramuscular intracompartment pressure. So let's say if such kind of patient comes to the emergency room with a history of trauma and then all of a sudden no pulse, this is a surgical emergency, medical emergency. The immediate treatment is fasciotomy. So what do we do in fasciotomy? We take the knife and then we cut this fascia. Cut this fascia. Once you cut the fascia, what happens? The muscle mass expand, and then there will be loosening of the connective tissue. So you have to cut, the surgeons cut two places. And once cut, there is relaxation and then recirculation of artery and veins. Everything start coming together and you can save the leg. Let's see somebody is in a place where there is no access to the medical facility. Then everything will be from here down, everything will be dead. And then amputation is the only possible treatment left. That's why this is surgical emergency. Okay, and that is called compartment syndrome. This is called acute compartment syndrome with the fracture. But sometimes we have chronic compartment syndrome. Like, let's say you are a marathon runner, and once you run, then that night when you go to bed, you have swelling and pain in the leg. But slowly it subsides. That is called chronic compartment syndrome, because due to the inflammation of the muscle, because it usually happens with the person who has not trained, because you produce a lot of lactic acid in the muscle, and that causes lactic acidosis, some inflammation, some fiber tear. But in that case, if you rest, I said treatment is RICE for chronic compartment syndrome. If you rest, if you put the ice, if you compression, give the compression and elevation, that will help. You don't need to do surgery in that case. Okay. So that is the compartment syndrome. Naming of the skeletal muscles. Skeletal muscles can be named based on their location, their shape, their relative size. For example, brachialis is in the brachium, in the arm. If the muscle's shape is triangular, then we call them deltoid. If there are three similar muscles and their size are different, then we call them maximus, minimus, and medimus. For example, gluteus maximus, gluteus minimus, gluteus medius. Okay. Okay. So that is direction of fascicles and muscle fibers. Some of the names are name tells the direction of muscle fibers, like rectus abdominis. Rectus means the muscle which is straight. Rectus means straight, which is straight to the abdomen is rectus abdominis. If it is transverse, then transverse abdominis. Where they are attached, like here in the neck, you have sternocleidomastoid muscle. That means it's starting from sternum and clavicle, and it is attached to the mastoid process of temporal bone. That's why you call them sternocleidomastoid. Or brachioradialis. That means it is attached to the brachium and radius. Number of origin, how many origins there? Like biceps has 2 heads, so we call them biceps brachii. Triceps has 3 heads, so we call them triceps. Quadriceps has 4, so we call them quadriceps. Axons, if some muscles are flexing, then we call them flexor. If they are extending, then extensor. If they are adducting, then adductors. If they are abducting, then abductors. Muscles of the abdomen. You see in the abdomen, the most superficial muscles in the abdomen is external oblique. And if you cut, Then you're going to see internal oblique, and then transversus abdominis. And on top of this, you have this rectus abdominis. When the six packs, these are the muscles, six packs, three each side. Okay. The tendon of the external oblique forms the canal for the inguinal canal, where inguinal ligament goes down. Okay. Sometimes this inguinal ligament is not closed or weak, and through that internal organs pass down, and that cause inguinal hernia. Okay. And in that case, you can put the finger, and if ask the patient to cuff, you can feel the intestinal organ coming here. Have you heard about the rotator cuff muscles, which is the muscles on the back of your shoulder joint? So on the back, you can see several muscles: trapezius, deltoid from the back, and this is latissimus dorsi. Here, deep muscles are the rhomboidus minor and rhomboidus major, and then supraspinatus, because this is above the spine of the scapula, and then infraspinatus, teres major and teres minor. So these muscles help in the establishing the shoulder joint when you are moving the shoulder joint. Okay, you are rotating, and that is rotator cuff muscles. So in the exam, if I ask which one of the following are not rotator cuff muscles are supraspinatus, infraspinatus, teres minus, and subscapularis. So supraspinatus, infraspinatus, teres minor, not the major. And then subscapularis, you cannot see here, that is under the scapula, deep in the scapula. You are looking from the back. Okay, so these muscles are rotator cuff muscles. To understand, you can see S, I, and lowercase t, and then uppercase S. Sits muscle are the rotator cuff muscles. Okay, so these are the rotator cuff muscles and lecture for today. Thank you, guys.
Thank you.
Thank you.